Health, wellness, and prevention. Three buzzwords that get a lot of attention these days. The federal government has even set a goal for 2020 to, quote, improve health-related quality of life and well-being for all individuals. So, what's the shift in the healthcare climate mean to all of us? Hormonal Health and Wellness Center's founder Terry Suresh and Dr. Michael Sheffield today here to talk about this really important topic. And Dr. Sheffield, I want to start with you. The terms health and wellness are getting a lot of attention. What's your take on this new direction in healthcare?
Well, I think it's become vitally important for us to recognize that much of our time in healthcare to this point has been about treating disease and trying to take care of patients who have already succumbed to some type of disease. The emphasis now needs to switch to all of those healthy patients who come for the physical, the
right.
once-a-year visit, and so forth. There's a lot more to being healthy and well than simply coming by to see the physician once a year to make sure nothing else has happened.
Terry, when you hear health-related well-being, what's that mean to you?
Well, what I think of is total body, mind, body, spirit. It's not just about band-aiding symptoms of diseases, to his point. It's all about looking for a root cause of disease, and prevention is absolutely the key to that. Our philosophy kind of is in line with the World Health Organization, who believes that that total wellness is that just everything. It's all-encompassing. It's social well-being. It's mental, emotional, spiritual, and physical.
And you and I have talked about that, how important it is to take care of yourself in all different ways, exercise, diet, everything you can do. Right. Doctor, what does it mean to you to be healthy? Well, sounds like a simple question, but it's not.
It's a simple question with a more difficult, all-encompassing answer. I think that the important points now are not just being fit. It's about, is your sleep good enough? Are you exercising enough? Are you eating well enough? Are you handling stress? Are you handling all of these things? I think that the role of the physician now is to partner with the patient to get together and to uniquely create a plan for the individual patient to come up with a way to maintain their health and to promote their own wellness.
So, Terry, since you're a professional in this area, what do you recommend to get started on a healthy plan?
Well, it's our big push for 2015 in our practices, and you know, historically we've focused on hormone balance and nutrition supplement, which is key and it's the foundation.
Right.
But layering in DNA testing and for weight and exercise and medications, and really working with Dr. Sheffield and helping the patients create a plan, to his point, that fits just them. It's called precision medicine, and honing right in on what that patient needs and not taking the guesswork out of creating a plan for them. So I recommend starting with getting blood work and coming in to see Dr. Sheffield or one of us and working on that plan.
So important to prevent something from happening.
No question.
Okay, you have a special offer that you want to tell viewers about, right?
Well, for all the Good Morning Texas viewers that call and schedule an appointment with Dr. Sheffield or one of the practitioners, gets a complimentary B12 Slim Shot series, and they're great for energy and to help us get through those summer months in the heat.
All right. Well, thank you. Dr. Sheffield, nice to have you with us today. Terry's always glad to be here, and we're glad to have her. So nice for you to join us. Thank you very much. You can find out more by calling Hormonal Health and Wellness Centers in Southlake. That number to call is 817-328-8376. In Rockwall, you can call 469-402-1877. You can, of course, also find out more online at hormonalhealthandwellness.com. Mention GMT, as Terry said, and you get a scheduled appointment and receive a complimentary series of 6 B12 Slim Shots, and we'll be right back.